Welcome to the final Level 4 video in the Complex Maternal Problems video series. This video, Other Complex Conditions, addresses a few other situations that DBEs might face at WIC. We will address hormonal conditions, chronic illnesses, moms with physical challenges, and mothers who have had bariatric surgery. Milk production depends on a complex balance of hormones. When this balance alters, it can affect milk production. Some common signs of a hormonal condition can be postpartum hemorrhaging or heavy bleeding after the birth. Delayed onset of lactogenesis, or DOL, can be due to hormonal issues. Lack of breast changes and low milk production can also result from some hormonal conditions. Hormonal conditions can contribute to low milk production for a variety of reasons. For example, if the placenta is not fully delivered or even a small area is retained, the mother's progesterone levels will not drop. This is necessary for the next stage of lactation or lactogenesis 2 to occur. If progesterone levels do not drop, prolactin cannot release. Polycystic ovary syndrome, or PCOS, is an endocrine disorder that interferes with the hormones that are needed for lactation. PCOS affects the growth of glandular tissue in the breast during pregnancy. Breasts that are hypoplastic or tubular in shape can sometimes be due to PCOS. Insulin is another hormone that has a very important role in lactation. Women who are diabetic or obese are also at risk of both DOL and low milk production. Another hormone condition might be pituitary dysfunction. This condition inhibits the release of prolactin. When assessing for hormonal conditions, if needed, a breast assessment can help you observe any breast or nipple conditions that could affect milk production or milk transfer. A breastfeeding history will help you learn about early practices that might have affected a mother's milk production. Find out about any breast changes that occurred during the mother's pregnancy. Does the mother have any signs of placental retention? Remember, those signs include excessive bleeding or clotting, continual pain, or even fever. You can also ask about any hormonal conditions or medical conditions that the mother has, and any medications she might be taking for a hormone condition. Some questions you might want to ask might be, describe any breast changes that you noticed during your pregnancy. Is your postpartum bleeding beginning to subside? What medical conditions do you have? Describe your early breastfeeding experience. What concerns did you experience? For example, DOL. When do you recall that your milk volumes began to increase? If the mother reported a hormonal condition during her pregnancy, encourage her to speak with her healthcare provider about treatment. Many medications for thyroid disorders, diabetes, and PCOS are compatible with both pregnancy and breastfeeding. You can share information about ways to get breastfeeding off to a great start. When a mother is at risk for DOL, those early practices such as skin-to-skin contact and frequent feedings are even more important. Encourage the mom to ask her hospital staff to help her if she worries about how breastfeeding is going. After the baby's born, you can offer weight checks at the WIC clinic. That will help you monitor the baby's weight trends. A breast pump might be needed to help her stimulate her production and remove milk. If the baby does need supplements, one option is to use a nursing supplementer at the breast. This can continue to stimulate the release of lactation hormones that are needed to produce milk. When mothers have hormonal conditions, you'll want to refer them to their healthcare provider for medications and treatment. Work with the CPA to assess the baby's weight trends and to tailor the food package. And of course, as always, the peer counselor can provide ongoing support. Bariatric surgeries are procedures done on the stomach or intestines to bring about weight loss. Although there is a variety of types of bariatric surgeries, gastric bypass is one of the most common. Increasing numbers of women of childbearing age are choosing to have this surgery. Gastric bypass surgery can affect breastfeeding. Some common signs of problems might be DOL, low milk production, and lack of breast changes during the pregnancy and beyond. Some mothers report that it's uncomfortable to position and latch their infant. The baby can also be at risk of slow or faltering weight gain. Encourage mothers who have had gastric bypass surgery to breastfeed. However, be aware that the surgery can cause lactation issues, especially if the mother experienced rapid weight loss. One of the signs of that is sagging or long pendulous breasts from the reduction in fat tissue. The woman in this photo had gastric bypass surgery. Look at how her breasts look now. It can be difficult for the baby to latch onto sagging breasts. Some mothers elect to have a breast lift or reduction surgery to correct this. As we already discussed in the breast conditions video, this can affect lactation, depending on the type of surgery that was done. Another complication of bypass surgery is that some mothers will develop vitamin B12 deficiency or iron deficiency anemia. This can affect the baby's ability to gain weight. If needed, a breast assessment might be helpful. This can help you look for signs of breast ptosis or breast sagging. Observe for any breast or nipple problems. Ask about any scars that you see. If the mother had breast surgery, find out what type she had and how it might affect her ability to make sufficient milk. As part of your assessment, take a breastfeeding history. Learn about any issues that the mother had with delayed onset of lactogenesis or any issues with milk production. Find out if she had normal breast changes during her pregnancy. You can also learn if she had any vitamin deficiencies. This can be common after gastric bypass surgery. Assess the baby to note weight and growth trends. Some questions you might want to ask: how long ago did you have your surgery and how did it go? What weight changes have you experienced since your surgery? What vitamin and mineral supplements are you taking? What other medical conditions or surgeries did you have? What breast changes did you notice during your pregnancy? What about after the baby was born? If you are able to speak with the mother during pregnancy, emphasize the importance of early practices to get a great start with breastfeeding. She can continue to hold her baby skin to skin. Suggest she try laid-back breastfeeding. That can help the baby latch to more pendulous or sagging breasts. This can help the baby work with gravity to get a deeper latch. Refer to the baby's healthcare provider if the bariatric surgery has resulted in vitamin deficiencies that are affecting the baby's growth. You can work with the CPA to assess the baby and tailor the mother's food package. The peer counselor can give ongoing encouragement and support. A variety of chronic illnesses can affect a mother's ability to breastfeed. These can include autoimmune diseases such as lupus or multiple sclerosis. Mothers with neurological injuries or diseases such as epilepsy or spinal injuries can also affect her ability to breastfeed. Physical injuries and even diseases such as cancer can have a negative effect on her ability to reach her breastfeeding goals. Each chronic condition has its own risks and can cause varied breastfeeding concerns. In some cases, the illness or injury can cause low milk production. Sometimes they cause physical challenges with positioning and latching the baby. Mothers with lupus might experience Raynaud's phenomenon with vasospasm in the nipples. Mothers with multiple sclerosis might have a lower risk of relapse during pregnancy. However, flare-ups after the baby is born might pose physical challenges with her being able to handle her baby. Mothers who have rheumatoid arthritis may have reduced symptoms in pregnancy and lactation. However, some medications that treat the disease are not compatible with breastfeeding. Mothers with muscular or neurological injuries or disorders may have trouble with the physical ability to hold their baby. Mothers with epilepsy might face the possibility of seizures while caring for the baby, no matter how the baby is feeding. The good news is that many medications for treatment are safe during lactation. A mother with cancer may need to undergo treatment options such as radiation or chemotherapy. These are not compatible with breastfeeding. As part of your assessment, learn more about the mother's history of chronic conditions. What treatment plan is she undergoing? Gather information on her early breastfeeding experience. How have things improved or changed? Find out what her healthcare provider advises regarding breastfeeding. Learn what the mother knows about breastfeeding with her illness. Ask about her fatigue levels. Fatigue can be more common when mothers have a chronic illness. Some good questions to ask might be, tell me how well you're addressing any fatigue issues with your illness. Tell me more about your illness. What symptoms are interfering with your ability to breastfeed? What worries you most about breastfeeding with your condition? What do you know about your ability to breastfeed with this illness? The mother's healthcare provider will provide care and follow-up to the mother. As a DBE, your role is to give her tips and solutions to make breastfeeding a little easier. Customize your suggestions to the limitations of the mother's illness and her goals. For example, you might help her find solutions to her fatigue. She can nap, for example, when the baby naps. Suggest she get help with household chores and other daily challenges. She needs to let family members know about her needs. You can share positioning options if the mother has physical concerns about being able to breastfeed. In some cases, the mother might benefit from a breastfeeding aid to help her maintain or build her production. Therapeutic breast massage might help her minimize engorgement and help her keep her breasts well drained. Mothers with a chronic illness will be under continual medical care. You can refer the mother to her provider if she has questions about the safety of certain medications and treatments while she is breastfeeding. Work with the CPA to assess the baby's weight trends and develop a feeding plan if the mother's not able to produce sufficient milk given her illness. You can also work with the CPA to tailor the mother's food package. Refer the mother to her peer counselor for ongoing support. A variety of physical challenges can sometimes affect a mother's ability to breastfeed. Some challenges are the result of physical anomalies. Others might result from injury or illness. Some examples are spinal cord injuries, congenital limb absence, or maybe a stroke that affected the use of her arms and hands. Visual impairment can be another physical challenge. Even surgery in the early postpartum period can affect her physical ability to breastfeed her baby. Physical challenges, such as being confined to a wheelchair, might affect the mother's ability to hold her baby or to latch easily. A mother who is missing an arm or a hand may find it hard to adjust her clothing for nursing to feed the baby. Mothers with spinal cord injuries may have an impaired milk ejection reflex, which can cause low milk production. Sometimes well-meaning family members and friends urge the mother not to breastfeed because they may perceive it will be too hard. As part of your assessment, learn more about the mother's history to understand the nature of her physical challenges. Find out if she takes medications that are known to compromise milk production. As a part of the history, learn about any early breastfeeding challenges. How did she manage them with her limitations? Ask what solutions the mother has already devised to help her address these challenges. And find out what the mother's and her baby's healthcare providers advise her about breastfeeding. Some good questions to ask might be, tell me more about your physical challenge. How long have you experienced it, and what changes have you made in your life as a result? What concerns do you have about being able to breastfeed? Tell me more about why you decided to breastfeed. What has your healthcare provider told you about breastfeeding? What do you know about breastfeeding with physical challenges? Many women with physical challenges are able to breastfeed. In fact, it might actually be easier than having to prepare and feed bottles. Often, some creative positions can make the difference. In this photo, the mother has chosen to feed her baby in a side-lying position. Other moms might nurse in a wheelchair by using a sling to keep the baby close. Some mothers report that by around 3 months, their baby helps the mother by self-latching. This can certainly make feedings much easier. Perhaps a family member or a support person can bring the baby to the mother for feedings. Another option for feeding is to adjust the height of a changing table so the baby can lie on that table. The mother then rolls her wheelchair over to the table to feed the baby. A table or a countertop could also work as long as the baby is secure. Suggest that the mom elevate her feet. This can raise her lap so the baby can have better access to her breast. Some mothers will choose to pump one or both breasts so that other caregivers can give her milk to the baby. Refer a mother with physical disabilities to her healthcare provider if concerns develop. Work with the CPA to assess the baby's weight trends. Refer to the baby's provider if the baby's growth is affected. You can also work with the CPA to tailor the mother's food package. Refer to the peer counselor for ongoing support. You can also refer mothers to any local or online support groups, as well as to any resources for visually hearing and physically impaired individuals. This ends the Level 4 video, Other Complex Conditions, in the Complex Maternal Problems video series. Please take a few moments to pull out your WIC Action Journal and turn to the Complex Maternal Problems page. Write down something you did not know before viewing this video, or something you want to be sure and remember. Set at least one goal of something you will do with what you have learned. Please complete the Level 4 post-test for this video. Turn it into your supervisor along with any handouts for this video series.